Okay, welcome everyone. We're just going to give it a couple of minutes as people are signing in, and then we'll kick off for today. Hi, everybody. Welcome to our GNC satellite event. This morning or this afternoon for you is a progress update and a Q&A session with the GNC Technical Alliance. And we're really happy to have you join us this morning or today. My name is Colleen Emery. I'm a senior technical advisor with World Vision International, and World Vision is serving as the Ngo Co-Lead at this time. I'd like to welcome my co-host, Megan. Do you just want to say hello?
Hi, everyone. My name is Megan. I am a nutrition specialist here at UNICEF HQ, and I am the co-lead from UNICEF side for the Alliance. Thanks, Colleen.
Great. So I think we're going to go ahead and kick off. I know folks are still signing in, but we do have a packed agenda for us here. So Ben, if you could just move the slides for me, that would be great. So our agenda for today, we're just going to start off with a recap about what we do. And then Megan's going to present on the progress of the Alliance over the past 6 months. Then we're going to have a spotlight on some of the technical support work that we have provided over this past 6 months. And we welcome Abdi and Martha to do that for us. And then we're going to close off today with a Q&A panel. And so if you have questions about the Technical Alliance, as we're going through things today, if you could put them in the chat box, and then once we get to that Q&A time at the end, we'll do our best to answer them. And rest assured, we are going to use your input today to put together an FAQ document that we will have available after. So if by chance we don't get through everything today, we will have something available that we can come back to after. So that's our agenda. Now, Ben, if I can get you to launch the video, that would be great.
Bear with me, please. Colleen, if there's something you can do for 1 minute, that would be most appreciated.
Okay. Megan, what should we do for 1 minute? Just thinking we've covered our housekeeping. Yeah, please use the question and answer. Just for those I know that are still coming in, welcome. Here's our agenda for today. We're just going to show a short video at the beginning here, which is about just over 3 minutes long, and it explains what the Alliance does and how to access support. And as I mentioned, we're going to have a Q&A panel as part of our session. So please put your questions in the chat box as we go along. Ben, it looks like you're ready. Yes?
Great. You'll just have to tell me if the sound should come through, but if it doesn't, please say.
Okay.
There are many events that can throw a country into crisis. Disease outbreaks, natural hazards, or conflicts. Most crises will affect all areas of daily life. Accessing support should be easy, especially for something as essential as nutrition. For this purpose, the Global Nutrition Cluster Technical Alliance was developed. Whenever nutrition is at risk, we help to identify the problems that are stopping or slowing down progress. And together, we will work on technical solutions. So, let's say you work in the field of nutrition and are facing an emergency that you either have to prepare for, recover from, or react to, and you need support. Contact us. Scroll down to the request form, ask a question, or describe the challenge you are facing. We will look at your request, and together we will work out what is needed and ensure that this support reaches you as quickly as possible. This might be providing up-to-date guidance and advice on how to apply it to your specific context. In-depth technical support, where we work together to find the technical resources that are needed, or recommending technically vetted external consultants. This technical guidance covers well-known situations. But what happens when something new or unknown comes along? Our global thematic working groups quickly provide interim guidance or resources when there is no specific guidance yet, as with a new disease, new scientific knowledge, or when experts disagree. So, how much does our support cost? Well, some help is free, some is not. But we will work with you to find a cost option that meets your needs. Our alliance aims to use local capacity. If that capacity is not available, we will work with you to build it. And only as a last resort will we use regional or global resources. If you ever have to deal with a nutrition emergency, please let us know. We are here for you.
Thanks very much, Ben. And maybe we can put that video link in the in the chat if people want to watch it later. I know because it was streaming over the internet, it wasn't smooth at all times, and it is something that you can share with your colleagues and with partners in the field to help us get the word out about what the Alliance is and what we do and how to access support. So now I'm going to hand over to Megan, and she's going to give us an update on the progress of the Alliance over the last 6 months. Next slide, Ben, please.
Great, thanks, Colleen. So the Technical Alliance was launched 6 months ago, and we've had a really productive first couple of quarters. So now I have about 5 minutes to give an update of what we've been doing in the last 6 months. So just as a quick refresh, the Alliance was formed after a strategic review period in 2020, where we rebranded the GTAM to the GNC Technical Alliance. We decided to change the name to the GNC Technical Alliance, as it best reflected the relationship with the GNC and the collective ambition of the GNC partners to provide more quality technical support to the collective. As explained by our explainer video, the Alliance provides specific services to practitioners in any country of the world preparing or responding to an emergency. So the first is answers to questions. The second is in-depth technical support. This can be either remote or in country. And the third is the development of stopgap guidance. So I will just give in those 3 areas, I'll just give you a quick update of what we've been doing in the last 6 months. Next slide, thanks, Ben. So this is the structure of the Technical Alliance. It's led by UNICEF and co-led by World Vision. We are supported by the leadership team, and the organizations in the leadership team at the moment are represented by the logos. It's important to note that the Alliance, similar to the GNC partners, it includes you. So the cluster partners, academia, and other actors working in nutrition and other sectors. To deliver the services I just mentioned, the Alliance is structured in 3 main areas: thought leadership, technical support, and knowledge management. And the leadership of those 3 areas, again, is denoted by the logos in this graphic. Next slide, thanks, Ben. Now to share with you some key highlights. The website was launched in June 2020, and in the last 6 months, we've had more than 3,300 new website users from 140 different countries. A total of 124 queries for support have been logged. This was as of the end of last month. And the most requested technical areas were infant and young child feeding and emergencies, followed by nutrition information systems, and third, wasting. So from this graph, you can see that we've had a pretty good distribution of different areas, of technical areas that have been requested. Next slide. The requests for support have come from all over the world, with more than a quarter coming from East Southern Africa, almost 1 in 5 coming from Middle East and North Africa, this really reflecting the humanitarian crisis in Yemen. But again, we've had a pretty good distribution in terms of requests coming from the different regions. Next slide. The most requests are coming from UN agencies, followed by international NGOs. One of our objectives for our first year as operating under the Alliance is to really increase our visibility with local and national actors. So we hope when we're giving an update in 6 months' time at the end of our first year that we will see more requests from local and national organizations, including governments. Next slide, please. So in terms of our technical support team, this is all of the faces of the technical support team. It's really grown and it includes the former Tech Rapid Response team. It includes the GNC Rapid Response team, Help Desk, our UNICEF Emergency Response team, Tst Partners, and a consultant roster, which has more than 120 vetted consultants. On this slide, you'll see that there's a number of partner logos at the bottom, and they are the organizations who currently host our technical support team staff. So the faces on the top left of the screen here is our TST coordination unit. And on the right are our help desks. The long bottom of the row represents our deployable advisors who have different technical specialties. So in the past 6 months, this team has undertaken 18 pieces of in-depth technical support, 6 of which have been partly in-country and 12 remote in 14 contexts, including Nigeria, Mozambique, Ethiopia, Sudan, Myanmar, Nicaragua, Venezuela, and Madagascar. There's also been 19 requests and 18 recommendations for the consultant roster, and this has resulted in 5 of the consultants on the rosters being hired. So obviously in the last 6 months, in terms of the technical support that's been delivered, we've really had to continue the pivot from what was previously very much a model where in-depth technical support was provided in country to more of one that's much more flexible, which can include remote support. Next slide, please. My final slide, just to update you on our global thematic working groups. We now have 4. The 4th that was added since our launch last December is our Cash Voucher for Nutrition, GTWG. There's been a lot of work in the last 6 months by ENN and the chairs of the working groups to really mature these the working groups and to increase a more diverse participation. So continuing on from the enormous effort of the GTWGs during COVID last year to respond to new technical needs, the GTWGs have continued to develop guidance where gaps exist. So for example, the revision of operational guidance on how to apply WHO's breastfeeding counseling and emergencies course, and the development of a global task force for nutrition information systems for Yemen. So for access to products and outputs of each of these GTWGs, please visit the Alliance website. Okay, next slide. Okay, so that's it from me. I'll now be handing over to our colleagues Abdi and Somalia and Martha from the technical support team to give you an overview of what that technical support can look like. Over to you, Abdi and Martha.
Thanks, Megan. Good morning, good afternoon, and good evening to everyone. Happy to meet all of you. I'm not going to spend a lot of time here. It's going to be Abdi that's sharing with us. So in our effort to really try and work with local organization, we provided support to RD, which is African Relief Development Initiative. It's a local organization in Somalia, and we provided support for capacity development in nutrition and emergencies, and did trainings on NIE itself and basic training on CMAM. And I'll give the floor to Abdi to share with you the process and what happened. I must say it was very exciting. It was remotely done. A combination of online trainings and webinars to ensure that the participants were really able to assimilate as much information as possible. Abdi? You're still on mute.
Yes. Thank you very much, Martha, for having me. It's a great pleasure for me to have this opportunity. My name is Abdi from ARDI, African Relief Development Initiative, operating in Lower Juba, Somalia, Jubaland. ARDI works with marginalized communities, mainly in areas which are having most needs, especially areas affected by natural disasters and man-made disasters. ARDI also accesses areas which are very far, hard to reach areas. These areas are all mainly controlled by insurgents. Considering the huge gap in the area and the humanitarian needs, ARDI conducts nutrition, health and wash integrated program in these areas. We could not do this alone because the capacity of our staff was very low and we needed support. So before 2020, only out of 23 staff, 3 of our staff have got training for imam. So the rest of the staff did not have any capacity. This year, we have managed to contact GNC Alliance through their website. The response we have received was very positive. I highly appreciate. GNC started training on imam, mainly on remote, and the training was covering 3 areas: mainly basic nutrition, 2 from Agora and 1 from MSF platform Tembo. The training period took 10 days. Number of staff that has been trained were 10 in number, 4 female and 7 men. The trained staff are now being deployed in the field. They managed to train 100 community volunteers. These community volunteers are now doing the actual work on ground. They are referring children to the SC MAM centers and SC centers. So far, they have managed to refer 50 children to SC centers in Kismayo and 50 children with SC severely malnutrition children to Kismayo, other agencies in Kismayo. The assistance we have received was very positive. The number of webinars we have received were 8 in number. We highly appreciate the support we have received. Our thanks goes to Martha for her support, dedication, for making this. We could not achieve all these results without GNC support. We highly appreciate GNC support. We wish to continue this engagement in the future. ARDI is very local organization operating on ground, and we need more support from GNC. Local organizations are doing great work on ground. They are very close to the community. They help the community. They live with the community. They also negotiate access in these areas. ARDI also has good comparative advantage. ARDI is the only organization operating in these areas. There are no other organizations operating in these areas. So the material needs are very immense. So far, the admission trend has increased. The coverage has increased. This could not have been possible without the support we have received from GNC. This training has been very useful. Our staff have enjoyed very well with the training. They have learned different kind of malnutrition and how malnutrition affects different age groups, including pregnant lactating mothers. Thank you very much for this support. Local NGOs are very useful. Knowledge is power. Learning is very good, and we need this support. Now learning saves lives. Thank you very much for giving me this opportunity. It's a great pleasure for me. Thank you very much.
Thanks,
Thank you.
Abdi, and over to you, Colin.
Great. Thanks very much, Abdi, for sharing your experience. And as Megan said, hopefully in 6 months from now, when we report out on the Alliance, we'll have more requests coming in from local CBOs and organizations. And so please, all of you, continue to share the word about the Alliance through your various colleagues and networks so we can continue to get the word out about the supports available. So we're going to transition now to a question and answer panel with the Alliance leadership team. So I'm going to pass over to Ngo from WFP, who has kindly agreed to lead us through this panel discussion. Thanks, Nicholas.
Thank you, Colleen, and good morning, good afternoon, good evening, all partners. Really good to see you here today. I just want to congratulate also the presenters for the very clear and informative presentation, and also for giving the opportunity to hear the voices from the field and from an organization that has directly benefited from the support of the GNC Technical Alliance and the very positive impact of this support to partners who are really at the front line of nutrition crisis sometimes in very difficult operational context. So I'm very pleased to facilitate now this panel discussion. I just would like to briefly introduce the panel members. So I don't need to reintroduce Colleen, who is a Senior Nutrition Advisor at World Vision International and co-leading the GNC Technical Alliance. Megan Gifford, so nutrition specialist at UNICEF Nutrition Division. And I would like also to invite Andy Kendall, the coordinator of the technical support team of the GNC Technical Alliance, and Tanya Kara, who is a technical director at ENN. And yes, and to the participants, I really encourage you not to be shy and raise your hand or post any questions that you may have in the chat box. That's really your chance to ask for any clarification that you may want, or any question you may want to ask to the leadership group of this GNC Technical Alliance. And so I suggest we start with this question from Stephen Williams. Can all nutrition actors in all countries access this great facility? Or is it only limited to GNC countries or GNC partners? And maybe Colleen or Megan, do you want to take that one?
Sure, I can start it off, and then I'm wondering, Andy, if you want to add to it, just in terms of, I know there are some constraints around where deployable support can be provided. But no, in principle, the GNC Technical Alliance is available for anyone, anywhere in the world, who's either preparing for, reacting to, or coming out of an emergency situation. So it isn't something that's only available to those that are partners within, those agencies that are partners within the current GNC structure. Andy, maybe you can speak a little bit to the how and when we can deploy.
Great, yes, okay, thank you, Colleen. In general, we can support all of the contexts that Colleen has mentioned: preparedness, response, recovery. The caveat is that if you require that we pay for the support that is going to be provided, that it has to be within where we have funds for. So basically we have different donors. We try to make sure that we have a variety of donors so that we're able to respond to any request within any of those contexts. It's always a discussion. We figure out where to get the funds when it's needed, so don't hesitate to request.
All right, thank you very much, Andy. So maybe I have another question for you, Andy, still regarding the work that the technical support is provided. Can you please tell us who ensures that this technical support provided by the Alliance follow the coherent advice of the collective when issues are raised from the field?
Great, okay, thank you, Nicola. We have a lot of checks and balance in place for the technical support team to ensure the technical support is of high quality and based on global best practice. not that it is reflecting a specific agency's stance on an issue, but working towards the needs of the specific country. So that there's the whole process of developing TORs, which involves the requester and any relevant stakeholders that are involved in the request. It involves technical advisors, it involves TST coordination. This typically involves a handful of people from different agencies as a starting point. Then we also have a deployment steering committee with representatives from at least 6 different agencies, including UNICEF, including the GNC coordination team, as well as the organizations involved with standby partners. So that is that are all involved. So Save the Children at the moment, and Action Against Hunger, and International Medical Corps. We have a lot of quality assurance and backstopping, quality assurance measures, which includes backstopping for all support to ensure that there are different views on the work that's being provided and that it's of high quality and reflects global best practice. When there are issues that are a little bit more, that are newer or potentially contentious, we also can reach out, obviously, to the global thematic working groups through the thought leadership stream to make sure that we're getting the involvement of the right people at the right time to make sure that we are providing support that reflects that the consensus across the streams. We also, where there's something that's contentious, we work really with the country to figure out what the best solution is for them.
Yes, thank you very much, Andy. And there is another very interesting question in the chat box from Sahed. Rich, can organizations apply to join the Alliance for thematic areas? They have capacity locally or regionally, or is it only for external individual consultants? And I just would like maybe to broaden a little bit the scope of this question and to also ask the panelists how the member of the leadership team of this technical alliance were selected, and is there a term of duration for the leadership team membership, and what's the opportunity for the GNC partners to apply to the leadership team and to other thematic area or technical working group of the GNC Technical Alliance? So maybe Megan or Colleen?
Maybe I'll just start off by speaking about the Ngo Co-Lead Role, and then Megan, I can pass over to you for the other parts of that question. So the Ngo Co-Lead Role, how it worked to date, it was there was a terms of reference put out, and NGOs that were GNC partners were invited to apply, and then the selection was made by the SAG of the GNC. So the current NGO term runs through to the end of 2023, and then there will be a period where that role will change to another GNC partner. So that's the process to date on that. Megan, over to you now.
Sure, thanks, Colleen. So the leadership team is composed of the organizations who have a specific role within the Alliance. So for example, ENN oversees the thought leadership section or pillar. So they have a seat currently within the leadership team. I think what is really important to know is that you don't need to apply to be part of the Alliance. If you're working in nutrition and emergency context in any form, you are already part of the Alliance community. If you do want to have a specific role, and we really encourage you to reach out on this point, if you do want to have a specific role within our global thematic working groups in infant and young child feeding and emergencies, nutrition information systems, cash and voucher assistance, and the area of wasting, really to reach out. And ENN, on the website is information about the GTWGs, and ENN is our focal point for managing those. And over the last 6 months, a lot of work has been put into defining the membership arrangements and the like. So maybe Tanya, you could add a little bit more there about how people can be involved in the GTWGs.
Thanks, Megan. Yes, of course. Each of the GTWGs does have the terms of reference, and there's an existing membership. But as Megan says, the membership is very much based around expertise in that thematic area. So organizations or individuals who have expertise in that area, do please and would like to join that group. We can share the TOR so you can see what it entails being a member of the group. But do get in contact with us directly, sort of, it can be myself or Natalie. Our contacts are on the website, or directly with the chairs of the working groups themselves. Because our aim, as Megan said, is to make sure those groups are fit for purpose, to be providing that advice in areas where consensus is needed, where answers aren't as clear, and also to make sure we have good representation from regional and country level on those groups.
Thanks, Tanya. Andy, could you very briefly say a few words about becoming a TST partner as well within the Alliance?
Absolutely, thank you, Megan. To provide technical support to countries, I think you all are clear that you put in a request. The question is, how do we provide the support? We are looking to provide support with a focus on finding the most locally available option. We have a group of TST partners, this is what we've been calling them, that we reach out to see who has technical support, who has the ability to provide the technical support that's being requested. So to become a TST partner, in January of 2020, sorry, I'm confusing exactly when it happened, 2019, we reached out to all GNC partners to become TST partners if they were interested to provide technical support to the collective. We have a group that is playing that role, but we will be continuing. In the coming months, I expect from September, we'll start opening that up again to be able to have new partners joining, to work with partners to really see how that we can bring in partners from outside of necessarily the GNC members, because we have partners that, for example, development partners that are that bring a wealth of expertise and knowledge in nutrition that we could benefit from within nutrition and emergencies. So we'll be opening that up again and sharing more information. In the meantime, other partners are able to join just by sending an email to the email address that has been shared, and we can discuss it if you're interested to provide support to the collective.
All right, thank you very much, Andy, Tanya, Megan, and Colleen for these very clear answers. And I just would like maybe to have a follow-up question on this before I let our dear Global Nutrition Cluster Coordinator to say a few words about, I mean, we are living in a world of where there is an increase and almost record high number of nutrition crises, I mean, all over the places, and the need for technical assistance to help our partners in the field to design and implement nutrition in emergency response may increase or is already increasing. So my question is, in case there are multiple and concurrent requests, how does the Alliance prioritize this request? And maybe that's a question for you, Andy.
Great, thank you, Nicola. This is a really great question. We aim, in fact, we have conditions and criteria in place that help us to prioritize and be clear on what we can support and what we can't support. So countries within those conditions and criteria, there are countries with very high severity, according to the Informed Classification Index, humanitarian crises, whether chronic or rapid onset, countries with limited technical capacity in NIE, so what we could call some of the forgotten emergencies. We need to always make sure that it does not duplicate other support that is either in process or being planned in the pipeline. We also prioritize local national actors We generally try not to, if a request falls within the criteria that is within our mandate, we really do our best to see how to find solutions to fulfill them. Whether that be working on the timing of the requests, is it urgent right now? Can it be delayed by a month or not? Some contexts it can, some contexts it cannot. And we try to, whether we provide the support through any of our Tst partners or through consultants, we try to find ways to link up with support with technical assistance providers within our network. Whether we do it, whether others do it, we really try to make sure that everyone has an answer for the needs that they have.
Thank you very much, Andy. So before I ask another questions to the panelists, or if there is any other question from the participants in the chat, I would like to let Stefano to say a few words. Over to you, Stefano.
Thank you very much. Just a couple of words. The team already, the panel is already well established that you know, there has been major progress done in the development of this platform, which our aim has always been that we really needed a one-stop solution to technical queries for all partners, including local authorities, national authorities and organizations, to address the needs of people in emergencies. And I think that the totals that have been indicated previously really shows that already this platform, which was rebranded and redeveloped at the beginning of the COVID response, has managed to do a lot in very difficult circumstances. So I think this really shows how, when partners come together with shared objectives, how much can be achieved. And I'm sure that the service will grow in strength and in recognition. I just wanted to mention one thing, though, that there are the GNC coordination team from Geneva specifically supports the assistance on 4 thematics, which are primarily sectoral coordination, intersectoral coordination, information management, and nutrition information systems. And it's not all the support that has been provided at the moment is reflected in the information that was shared earlier on, because sometimes the requests come directly to the people that our colleagues in the field are used to speak to. So we are still trying to tweak the system to make sure that this type of assistance is also recorded and really also shows the whole effect of the platform. So I think we can look forward to additional information on how together we are the Nutrition Collective is supporting the best preparedness and response to emergencies. Thanks a lot.
Thank you very much, Stefano, for this few words and this clarification. As I don't see people are shy, they don't post any question. I don't see any hand raised. So I will continue asking some question to the panelists, and there is one that it is burning for me. I mean, it's about one of the key area of nutrition and emergency, one of the key thematic area that is covered by the GNC Technical Alliance, is the area of the prevention and treatment of child wasting. And that is an area there where there is a lot of work done very high on the agenda, a lot of new evidence on how to treat and prevent wasting. And there is also some this work done led by WHO in the development of new guidelines for the treatment and prevention of wasting. So my question would be, how are the partners of this alliance represented in this WHO-led process for the development of the new guidelines on wasting, and especially on the review of the normative guidance for the management of wasting. And maybe Tanya, I would like you to answer that question.
Thanks, Nicolas. I mean, maybe I can particularly say something about the global thematic working groups, because within the Alliance, they are the groups that are looking at where there are questions that come that are outside of current guidance, or need to be tailored to where current normative guidance needs to be tailored to a new context or something like that. So they're working in that sphere. Now, there are a number of members, particularly of the Wasting Global Thematic Working Group, that are also members of the guideline group that WHO have put together for the revision of the normative guidance on wasting prevention and treatment. And obviously there's quite a process along that WHO have for the development of that guideline, the updated guideline, that guideline development group are following along in that process. So there's a crossover with people, but equally we have WHO representatives actually across all of the global thematic working groups, so that we can ensure that the work of the groups is linking with WHO's normative guideline processes. So when questions are coming up, those are fed into any guideline processes that WHO is leading on. And we also have a system whereby we're checking in with WHO on the guideline process to ensure that what's coming out of the Alliance is feeding in, and also that we're at all the opportunities there are. And for example, on the wasting, alongside the guideline process, WHO will be starting a process of looking at implementation guidance. And this is where there's an even kind of closer connection with the sort of work that the GTWG on wasting are doing. And so we're talking about how we can make that link even closer on that implementation guidance, because that's really looking at the how those normative guidelines are implemented in practice, and the sort of questions that come up from the field in implementing that guideline.
Thank you very much, Tanya. Okay, so there is one last minute question. I think we still have time if the panelists can provide a very short answer before we close this session. And this question from Sarah. Can you describe the relationship between the GNC and the Global Nutrition Cluster Technical Alliance? Are each independent, or are there accountabilities and or reporting lines? And maybe I can, Megan or Colleen, would you like to answer that question? And then we close the panel. Thank you.
Yeah, I'll have the first go at that, and maybe Stefano can come in from the coordination team side. So we really see the GNC Technical Alliance as the technical arm of the GNC. The membership is really the same. So we are, as Stefano said, we're trying to make it as easy as possible for practitioners in any country to be able to request support, whether that be around wasting, whether it be around information management for coordination. We don't want that to matter. We just want you to have one place to come to be able to request technical support. So the Technical Alliance is co-led by UNICEF as a cluster lead agency. So we have that consistency across both the GNC and also the GNC Technical Alliance. We do have different accountabilities and different reporting lines. So for example, the Alliance has really generous funding from BHA, So we have our own accountabilities to our specific resource partners. But that being said, as we kind of progress and we have more experience as a technical alliance, we are trying to find efficiencies wherever possible with the GNC. So you will notice that we now have joint newsletters, for example, we have joint monitoring reports. You're on the website for the Technical Alliance, which is connected to the GNC website. We are sharing kind of some of the back-end infrastructure as well. So I hope that kind of gives an idea, but I think I would suggest that you just see us all as one service provider, and you just come and we will work out who within this, the GNC and the GNC Technical Alliance is best positioned to provide the technical support that you need. Stefano, would you like to add anything to that super quick?
Yes, just that the GNC Technical Alliance is composed really by the collective, and there are different roles for different partners and so on. But maybe the question was more referring to the GNC coordination team based in Geneva. And I can, the GNC coordination team based in Geneva is composed by about 12 people at the moment. And we do facilitate some of the technical support, as I mentioned earlier on, primarily on specific thematic like sexual coordination, intersexual coordination, information management, and some components of nutrition information systems. And the GNC coordination team is actually part of the GNC Technical Alliance leadership team.
All right, thank you very much, Stefano and Megan. I see that more questions now are popping up, but I think it's time now to wrap up and to close at least this Q&A session. So thank you very much for your attention and for all the good questions. And I hand over to Megan.
Great, thanks, Nico. So I just want to say a big thank you to everyone for joining today. I hope that you have some more information and insight into the GNC Technical Alliance. Please keep the questions coming. You can access information on our website or reach out to us directly for more information. And I just want to say a big thank you also to all of the people who have made the GNC Technical Alliance possible. The volume of technical support that's been provided in the last 6 months and previous when we were operating as a GTAM, it really is enormous. And for that to happen, there's just an enormous amount of work that goes into it. So I want to say a big thank you to everyone who has contributed to providing that technical support. And just a final word to say thank you also to the generous resource partners that we have for the GNC Technical Alliance. Namely BHA, who have made this possible. So with that, I will close. Have a good rest of your day, everyone.
We can launch the poll before we close, the feedback poll.